asked this question all the time. Clara, what's the difference between phlegm and dampness? Well, today I'm going to shed some light to help you understand those two entities and how we view them in Chinese medicine. Hi, I'm Clara. If it's your first time here, I create Chinese medicine content for acupuncture students and practitioners, making it easy to grasp and fun to learn. If you haven't subscribed yet, go ahead and do it and click the bell so you don't miss out on any future videos. Okay, so the phlegm and dampness thing in Chinese medicine, what? So I'm not sure what to do with it. A lot of my students always ask that. Okay, so no matter what, phlegm and dampness are accumulation of fluids, right? Phlegm is thicker, dampness is a little bit less thick, more fluid. Remember that in Chinese medicine, body fluids, jin ye, body fluids, are thick fluids and thin fluids, right? The thin fluids could be urination, tears, or sweat. The thick fluid is more organs, the brain, the marrow, that is very much more thicker. Okay, so that's the normal stuff. Let's talk about excess dampness and excess phlegm, which are not easy to get rid of, unfortunately. Excess dampness will show up with symptoms of water retention, like bloating, edema, right? Edema, swelling, that's excess dampness. Having excess saliva in the mouth, having excess vaginal discharge for women that is abnormal, like a lot of vaginal discharge, that is abnormal. Having tendency to have very loose stools or diarrhea, that is all damp. Having tendency to have post-nasal drip, right? Our nose is dripping all the time. That is excess damp. Yes? Okay. Let's look at excess phlegm. Excess phlegm is going to be coughing phlegm, right? The word phlegm, we coughing phlegm, thick phlegm, that is phlegm. Also, phlegm can be due to cysts. So cysts are made of phlegm, but also blood stasis as well. So cysts are going to be phlegmy. It doesn't matter if it's a ganglion or an ovarian cyst. This is phlegm. Make sense? Okay. Phlegm is going to be something that is going to be very crystallized as well. So for patients that have rheumatoid arthritis and they start to have deformity in their joints and the joint starts to puff up really bad with crystals, that is phlegm as well. Now, what's interesting I found in TCM is that phlegm and damp have the same tongue and pulse, slippery pulse and greasy tongue coating. They also have tendency to have easy nausea. That is for both of them, right? If you have greasy skin or greasy hair, greasy scalp, that could be excess dampness or excess phlegm. So how do we differentiate? And can someone have both? Yes, someone can have dampness and phlegm. Not easy to treat. However, to differentiate, there's one thing that you can differentiate when you go to look at symptoms is the bowel movement. If there is dampness as the main bad guy, we're going to have loose stools or diarrhea. If there is phlegm, we will have formed stools, but sticky. Sticky stools means we need a lot of toilet paper to clean it up. That's sticky, but it will be formed stools. So formed stools with sticky stools versus damp, which is more diarrhea or loose stools. That's the difference. When it comes to treatment, if you're not sure when it comes to acupuncture, if your patient has more damp, more phlegm, you're still stuck, do both points. Spleen 9, best point for dampness. Stomach 40, best point for phlegm. Okay? Those two together can work really well. However, one more point. When there is phlegm, compared to dampness, there is also invisible phlegm. We have visible phlegm like the cyst and coughing phlegm and having excess phlegm in the body or excess thick mucus, I should say. But there is invisible phlegm. Invisible phlegm affects the mental health, the brain. And that can cause things from depression to Alzheimer's disease, which in TCM we say is phlegm. It could be causing manic behavior, bipolar, a lot of anxiety, a lot of mental health issues. In TCM we say there is phlegm misting the mind or misting the brain or misting the area. So that is phlegm and it affects the mind. And stomach 40 still works specifically for anxiety, depression, all those. But obviously we have to dig a little bit deeper when the mind is affected by phlegm because it's very difficult to treat. When it comes to food, we want to avoid all mucus-forming food. So for phlegm and for dampness, dairy, no. Sugar, no. Processed food, no. So those things are not great, right? Beer, alcohol, not great neither, unless it's hard liquor, I guess. So in general, we want to have food that is going to be more healthy, full of vegetables, things that get rid of dampness. Asparagus, really great for dampness. Dandelion, great for dampness. Lemon, ginger, those are great to dry dampness. Some are warm, some are hot, depending if, we have tendency to be more warm or hot. When it comes to phlegm, ginger is great for phlegm as well. Turmeric is great for that as well. So there is a lot of food that can help, but it's really important to stop eating the food that promotes it. Does that make sense? So I just wanted to go on quickly today to make this video because I get this question all the time. I hope I was able to shed some light on the difference between phlegm and dampness. And if you want to check out my books, my 3 books, you're welcome to. They're also available in digital version as well. You can go on my website, acuproacademy.com, and check them all out. They are very popular and the feedback on all of them has been very positive. I'm so happy and so proud that they're helping so many people. No matter what you're doing, keep rocking it using TCM, and I wish you a great rest of your day.